We're at Hospital Direct Medical. We're at USA MedBed looking at hospital bed models, and today we're looking at the Stryker Secure II. And the Stryker Secure II is a little bit of an older bed model. I'm right next to it, I have the Stryker Secure III, which is the newer version. But the Stryker Secure II is still a very durable and reliable hospital bed, very popular. We actually have it right now in a chair position. So you can see that one of the things that's nice about a full electric hospital bed that you get out of a hospital or from a hospital is that it does have a chair position. As one of the things that we do in some of these videos, we have a bed that you would get typically from an insurance company. And you can see you're going to have the head cranked up and down and then power up and down in foot. But that doesn't really tip the bed at an angle where you're comfortable. Just cranking the head up is really not always a real comfortable way of sitting in bed. And people recover faster when they're more vertical. So having somebody more vertical in a hospital bed during recovery is going to be super beneficial. So in addition to that, we're going to go ahead and just raise the bed up here real quick. And one of the things about the bed also is that it has a solid metal bed pan or a bed deck on it. So that's going to give you a lot of support. You can put an air or a foam mattress on this bed. Primarily, most of the time, you're going to see the bed equipped with a foam mattress, which is what we have on it right now. But it is also popular. It could be also used with an air mattress system. So on the outside rail here, you can see what I'm doing is I'm just going ahead and putting the bed back into a flat position. One thing about these beds, one of the questions we always get asked is, how high does the bed go? Well, in this case right here, you're going to be able to see that as I'm basically flattening the bed out, the bed itself is right to my hip level. So I'm 6 feet tall. It's coming up right to my hips, actually up to my belt line. And there's never going to be a need really for anybody to have to bend over to take care of a patient. And yet at the same time, it can still go down low enough where the person can get in and out of bed. Now, one of the things that I've done is I've opened up the bed rails on the side towards me. We call this an inverted rail. So basically you have a 2-gatch system option. So I'm going to push down once on this and I'm going to slide it over. And once I've slid it over, you can see what I've done is I've opened up the rail now in the middle. So if the person needs to get in and out of bed, you have some solid handrail systems here to support you. And, you know, as a person that's over 200 pounds, you know, I can do dips off the side of this thing. This is how solid these rails are. Solid steel frame bed, solid steel rails. And then, you know, if you have a situation where the person, you know, is at risk management for falling out of bed, you can close the rail system back up as well. But there's multiple different positions you can put these rails at. So you have controls on the outside of the rail. For the patient, you have controls on the inside of the rail. So they have the access to be able to do that from either side. And then you also do have what we call a nurse's station over here, where you have the different controls. Now you can lock it out 30 degrees if you see that 30 degree plus. Cardiac related patients, they want them at 30 degrees or more for their heart. And then you can lock that out in a hospital. They might just say, look, we're going to put this patient at 30 degrees. And then we're going to lock it out so they can't, you know, adjust it. We need them at that height. Trendelenburg, reverse Trendelenburg. Sometimes this is used for swelling of the feet, gout, things like that. And then at the same time, if somebody slides down to the bottom of the bed, they can use that Trendelenburg feature to help slide them up back to the head of the bed. And then you've got your basic head power foot. And then, of course, you've got the chair position right here, very popular. You just push that button, puts it into a chair. This will flatten the bed out. And then you have the bed exit alarm. And then last but not least, you have the scale. So this is really a durable, reliable bed. These are really popular overseas. A lot of these beds go over to international hospitals. But if you're looking for something for long-term care, home care, the Stryker Secure II is a great option. One other thing here, the brake down below, I'm going to just go ahead and kick that. And it's going to make a noise. So basically, that's going to prevent, the bed from sliding out on somebody. So, you know, that's also another great feature. You don't want the bed moving when people are trying to get in and out of bed. But when it comes to a solid steel frame bed, and like I was saying earlier, you know, you got solid metal down here. and it's not this right here where it's spring, where somebody my size will sink into the middle of this because there's really not good support. And for short-term use, that might be fine. But in many cases, for long-term and for higher levels of patient care, you're going to need more of a hospital-grade bed. Stryker and also Hillrom, which most of these beds in the showroom are Stryker and Hillrom beds, they do not sell to home care. So if you're looking to try to get one of these beds for home or for long-term care or for post-acute care, you have to go normally through a secondary market, which would be somebody like ourselves, where we take the beds, recertify them, refurbish them, resell them, and then ship them out all over the United States, all over the world. So if you're looking for a full electric hospital bed, the Stryker Secure II is a great option. It's priced right. You can go to our website, the number one, hospitalbeds.com, and also hospitalbedshop.com, and get pricing on this bed and all other beds that we carry. And we carry basically every bed model made by Stryker and Hillrom. And here in our showroom, we have a whole mixture of different beds that are both foam and air mattress beds. But this particular video today is on the Stryker Secure II. So for more information on the Stryker Secure II model 3002, give us a call. USA MedBed, Virginia is 540-327-7376. San Diego, California, 858-263-4894. You can get more information once again off our websites, number one, hospitalbeds.com or Hospital Bed Shop. Thank you so much for watching our video. If you have questions, give us a call, and we'll see you on the next video.